Lastly, I want to talk about the effects of alcohol on hormones. And I want to distinguish between low amounts of alcohol intake, higher amounts of alcohol intake, and again, this chronic alcohol intake versus occasional use versus really chronic use, meaning alcoholic or alcoholic use disorder where people are drinking an immense amount on an ongoing basis. The literature on alcohol and hormones is quite extensive, and there are, of course, many, many different types of hormones. The hormones that most often get mentioned and talked about on this podcast are the hormones testosterone and estrogen, which are present in both men and women, and that in both men and women are important for things like libido. They're also responsible for sexual development, actual development of the genitalia before birth and after birth. They're responsible, for instance, estrogen is important for memory and cognition. You never want to drop estrogen too low in men or women because it can disrupt cognition and joint health, etc. To keep this discussion relatively constrained, it's fair to say that alcohol, and in particular the toxic metabolites of alcohol, increase the conversion of testosterone to estrogen. Now, this occurs in a number of different tissues. This is not just occurring in the testes of males. This is occurring in lots of different tissues. And I'll refer you to an excellent review. We'll provide a link in the show note captions. This is a paper that was published in the year 2000, but the data are still quite strong. The journal is called, of all things, Alcohol. There's, yes, literally a journal called Alcohol for the publication of data and reviews on alcohol and its effects. And the title of the paper is, Can Alcohol Promote Aromatization of Androgens to Estrogens? Aromatization is this process of the conversion of testosterone and other androgens to estrogens through things like aromatase enzyme. And this is a beautiful review that describes every tissue or near every tissue from the ovary in females to the placenta, to the liver, to the testes, in which alcohol can increase the aromatization of testosterone to estrogen. Now, in females, this may be part of the reason why there's an increase in estrogen-related cancers. Breast cancer can be either estrogen-related or non-estrogen-related. There are other types of estrogen-related cancers outside of breast cancer, but it appears that one reason why alcohol increases the risk of breast cancer is because of this aromatization of testosterone, to estrogen. In males, accelerated or abnormal conversion of testosterone to estrogen can actually lead to growth of the breast tissue in males, so-called gynecomastia, or other effects of high estrogen, or I should say of altered testosterone-estrogen ratios, because that's really what's important. And these can include things like diminished sex drive, increased fat storage, and a number of other things that I think most people would find to be negative effects. I once talked about the fact that drinking alcohol can increase the aromatization of testosterone to estrogen. I posted that online, and I didn't get attacked, but I did get criticized for the fact that it has been shown, that small amounts of alcohol ingestion, so 5 grams or so of alcohol ingestion, this would be half a glass of wine or half a glass of beer, at least in some studies showed increases in testosterone, which was kind of surprising. But I should point out, other studies have shown that alcohol ingestion causes decreases in testosterone over time. So there's always this issue of whether or not you're looking at a study of acute exposure versus chronic exposure, one dose versus multiple doses and exposure. I think it's fair to say, based on my read of the literature, this review and other reviews that focus more particularly on humans, that regular ingestion of alcohol is going to increase estrogen levels, whether or not you're male or female, and it's largely doing that through the aromatization process by increasing the aromatase enzyme. Yes, there's some dose dependence, but I think if you're somebody who's trying to optimize your testosterone to estrogen ratio, regardless of whether or not you're male or female, well, then most certainly you're going to want to avoid drinking too much alcohol.